What's going on, everyone? Welcome back to Dennis Insider. Today we're going to talk about some pain. Um, you know what they say, no pain, no gain. So let's get started with somatosensory system. And this will include everything from pain, temperature, feeling of pressure, touch, vibration, proprioception. So all kind of P's in here. And we can divide this up into many different systems. So we have in conscious, basically conscious perception or conscious feeling. We will put that in as the medial meniscus system. And then we have two systems basically we can talk about is for pain and temperature. And that will depend on either the body, so which can be our spinal thalamic system, going from the spinal cord to the thalamus, and then or it can be the trigeminal thalamic, going from the trigeminal nucleus in the for the face, trigeminal thalamic. So this is just an overview I wanted to do. Break it down into, we will talk about all different types of basically pain, temperature, pressure, and how it flows up the body, basically. This is related to sensory receptors. Another thing that's very important is that all of the somatosensory are a 3-neuron chain. So basically, they all start with the first order neuron cell body, second cell body, and then third cell body, mostly in the thalamus. So let's start with all the innervation for pain, temperature, and then touch and proprioception. So I can start with, I will do blue in touch and proprioception. So that is your balance, vibrations, and then we can do in red the pain and temperature. So that I will follow that color scheme in the whole video. So for pain and temperature, we will do first body, and then the face, and similarly we'll do in the pain and temperature as well. So for the body, the first cell body is in the dorsal root ganglion, whereas in the face it is the trigeminal ganglion. And then it will travel by the fasciculus gracilis or fasciculus cuneatus, depending on where we are in the body. So for the arms, it's fasciculus cuneatus, and then for the legs, it's fasciculus gracilis. The way I like to remember is we touch the grass with our feet, so that will be everything below T6, and then everything above T6 is fasciculus cuneatus. Next, we will synapse at the second cell body. That will be is where we decussate or cross over. So just remember, second cell body is where we have the only changes in all of the system, and is also where we decussate. So for the body, from dorsal root ganglion, it comes up through the fasciculus gracilis or cuneatus, and it will synapse up top in the substantia gelatina, or sorry, in the nucleus gracilis and nucleus cuneatus in the medulla. So it will travel up to medulla and synapse at the nucleus cuneatus or nucleus gracilis. After that, we will travel with the IAF and then that is where it crosses over and it becomes the medial lemniscus. And so the touch and proprioception, we call it the medial lemniscus system, and it will synapse in the third cell bodies in the thalamus, and that's where all of these will synapse. For the body, it's always VPL for the whole system, and then face will always be VPM. After that, it will just go through the posterior limb, PLIC, to the cerebral cortex, or the homunculus, and we will talk about that. Going to the face, we start at the trigeminal ganglion. You feel some type of touch, proprioception. You will travel either from V1, V2, V3 in this ganglion, and then it will travel through the pons into the chief nucleus of trigeminal, or chief trigeminal nucleus. Then it will travel in the trigeminal thalamic tract, called that TT, trigeminal thalamic. It will reach the VPM, which I said will be in the thalamus for the face, for touch, proprioception, pain, and temperature. After that, once again, it will go into the PLIC, to the cerebral cortex, follow the homunculus where the face is. Now, talking about the pain and temperature, we will start once again for the body and the face. So body will start just like our touch in the dorsal root ganglion. It will go through the dorsolateral sulcus. Second cell bodies are in the substantia gelatinosa, and that is in the dorsal horn, gelatinosa, and that will travel or cross over, like I said, second, always after you synapse, will cross over, decussate via the anterior white commissure into, and will become the spinal thalamic tract. So this will be ST, spinal thalamic. And that will go synapse into the VPO, just like all of the body, and then through the posterior limb, PLIC, into the cerebral cortex. For face, we once again start from the trigeminal ganglion, V1, V2, V3. We'll go into the trigeminal ganglion. We'll go through the spinal trigeminal tract via the pons, spinal trigeminal tract. Will come synapse at the second cell bodies in the spinal trigeminal nucleus. So that is below this chief sensory nucleus of trigeminal, or chief nucleus of trigeminal. So the spinal trigeminal nucleus, the only difference is that here our axons had to descend or go down from the pons where they came in, and go down to the spinal trigeminal nucleus. Then they decussate or cross over and become the trigeminal thalamic tract, and go from the bottom trigeminal up top and go synapse in the thalamus at the VPN for the face. So if you feel a touch or pressure in the arm, you will synapse travel. First synapse will be in the dorsal root ganglion. It will travel in the fasciculus, or fasciculus cuneatus. Here, if you're coming from the legs, the same pressure or touch will come up through fasciculus gracilis. And both of these will enter the spinal cord, will not synapse, and they will travel up the spinal cord on the same side till they get to the thalamus, or sorry, the medulla is where they cross over. Sorry, till they get to the medulla. So let's just say the medulla. It's right here, and at this step is where they will synapse, cross over on the other side, and will go into our VPL for the body. So here, I'll label this. This is our VPL, and this bottom one is the VPM. So M is for the face, the more medial is for the face, the lateral is for the body. Similarly, if you feel, let's say you have our V1, V2, V3, or trigeminal, and you feel some type of touch in the face, in the upper lip by V2, it will go into our trigeminal ganglion. So the first cell body is trigeminal ganglion, will enter through the pons at some level, and the only problem is that it has to, for touch, will be at the same level, or will not go down, so it will go to the principal nucleus, and this is where the second cell body synapse is. It will cross over in the anterior white commissure, or sorry, in the for the IAF and become the medial meniscus. Got that wrong. So in our face, it will cross over as trigeminal thalamic tract and go approach the VPM for the face. Now, if we talk about pain, on the other hand, similarly, if we have some high temperature or pain, which I will do with red, we can have it in the lower body. So if it happens in the lower body, the only problem is only difference here is that for pain, it will synapse at the level it enters the spinal cord. Because pain is too fast, we cannot wait for it to go all the way to the medulla. So we synapse at the same level. It crosses over, and it will go up as spinal thalamic tract after it synapses at substantia gelatinosa, and will go up to the VPL. If we do pain in the face, we can do that here. So let's say we have some temperature that we feel in, or hot temperature, or some type of pain in V3. It will go once again in the trigeminal, just like our touch. It will synapse in the spinal trigeminal nucleus. It will still enter through the pons, but the problem is it has to descend because spinal trigeminal nucleus is on the bottom, and then it will cross over and then once again go to the VPM. So I hope that was not confusing. Here, the only thing I wanted to reiterate once again is that we have in the blue that we're talking about is the touch pressure proprioception system. In this one, it will travel through the medial meniscus. These are just some keywords I would like you to remember. Medial meniscus. It will synapse at the level of the medulla. So it'll always travel up. Whereas the pain and temperature, because it has to happen so fast, it will synapse at the same level of the spinal cord. So that is everything I was trying to say in this image. Didn't want to confuse everyone. So pain, temperature, synapse is at the same level of spinal cord, the second cell body, whereas touch and proprioception can wait. It travels in the fasciculus and will synapse in the medulla. So just remember, it always goes from our spinal cord. Picture. So go from the spinal cord, basically from dorsal root ganglion to the spinal cord, up into medulla, and then finally the third is in the thalamus, VPL or VPM. That is just general overview. Now, touch, proprioception, and we know this is all through a neuronal chain. So you can have the receptors can be things such as your Meissner corpuscle, your Merkel cell pack corpuscle, the Ruffini endings, free nerve endings, and then finally your muscle spindle and the Golgi tendon organ that tell us where we are in the body with the help of muscles and tendon. So just know touch and proprioception. It is a medial lemniscus system. And the second cell body will synapse at the medulla, whereas pain and temperature will synapse at the same level of spinal cord because pain is too fast and we have to tell the brain real quick. Okay, so if we start by, let's say, some type of muscle spindle, we feel the pressure when we pull our arm too much during the bench press, and your body's telling you, hey, you're too weak for this, slow down. So we will start from the muscle spindle. It will first synapse in the dorsal root ganglion. So the first cell body is the dorsal root ganglion. Like that. Dorsal root ganglion. So that's your first cell body. It can travel, let's just say, two ways. So if you're in the legs, if you're doing leg press, you will travel in the fasciculus gracilis, and let's just say you are doing bench, and you will travel through fasciculus cuneatus. And then I will just kind of try to join them, just to make life easier. So let's say they're traveling in close proximity, fasciculus gracilis and cuneatus. We know they will go synapse at the level of medulla only. So here we can have two cell bodies. So you can have nucleus cuneatus and then nucleus gracilis. So this is our second cell body, nucleus gracilis or nucleus cuneatus. It will travel via the IAF, cross over in the medulla, and that's when it becomes our medial lemniscus system. And third synapse or third cell body we know is in the VPL thalamus, because this is a body we're talking about. So we'll go all the way to the VPL, and depend, it's either if you're talking about the arms or if we're talking about the legs. In the VPL, and this is the medial lemniscus. Real quick, just wanted to do this real quick for the thalamus, VPM, and VPL. So we said VPN is the face, so I just like to draw it here. So here we have some eyes, there we have a nose, this guy's laying down, this is his mouth, you can draw his ears, with some here, and then here we have this guy, his arms, and then here he has his legs. So it has to follow the same homunculus here in the thalamus, as well as when it follows in the cerebral cortex. So from here, it will synapse in the thalamus, travel through the PLIC, which is for everything, and it will go depending where the homunculus is in our body, right? So I will just show you the homunculus similar to the thalamus. So just like I drew the face and the body here, the way it fits in the cerebral cortex is that this right here are you can say your legs, and he's kind of hunched over, or kind of laying over our brain. This tall guy, really tall guy, he has his arms right here, about in this section, and then his face is all the way over here, with pretty big lips. So depending on where you are, so if you're going to the legs, you will synapse here. If we're going to the upper arms or arms, we'll go here. If we're going to the face, we will go right here. Just like in the thalamus, if we're going to the face, we'll go to the VPM. If we're going more to the head, we will be more medial. If we're going more legs, we'll be back here of the VPL. Okay, so that was touch and proprioception, if we got that from the body, either arms or legs. Now, if we talk about our trigeminal ganglion for the face, so if we do touch, let's say we feel touch proprioception in the face, everything happens in the trigeminal V1, V2, V3. It joins in the trigeminal, then it will have to synapse. So our first cell bodies is in the trigeminal ganglion right here. It will synapse. Second cell body for sensory is right here in the in our chief sensory nucleus. And so the way I like to just draw chief sensory nucleus here, use this mean chief with his crown. Sorry, not too artistic here. So it will go into our chief nucleus of trigeminal, and it will synapse at the second cell body is right here. It will synapse, and like everything, second always crosses over, and it will go to the face as trigeminal thalamic, going from the trigeminal to thalamic, unlike the medial and the meniscus, which was for the body, to the thalamus. So trigeminal thalamic will go to the face and synapse. From there, the third cell bodies from the VPN, just like our body, will travel in the PLIC, and now we will just go into the face, wherever we need to go, V1, V2, V3. So that part is for the face. And now we can talk about our pain and temperature. So that I will start in red. Might start in the same area, but I'll write it on this side. So for pain, temperature, a few things to remember. There are A delta or C fibers, mostly closer to being unmyelinated, very slow pain. This is a spinal thalamic system or spinal thalamic tract. And we know that the second cell body will synapse at the same level because the pain is too fast and we can't wait. Same level is fine. So just know those few things, and now let's get started. So let's say you feel some type of pain in your muscles, or just a scratch. We will start that. Maybe want to do it on the same side, or it doesn't really matter. Yeah, it doesn't really matter. So let's just say we have some type of pain or lightning. You got struck by lightning, or you got into a fire, and that will go through the dorsal root ganglion once again. So that is the first cell bodies. It will synapse at the same level of the spinal cord. So we're already at the second cell body. It will cross over into the spinal cord, go on the other side. Oh, this got messy real quick. Okay. And it will travel all the way up to our thalamus, to the VPL, because this is a body. And this will travel as the spinal thalamic tract. And synapse here in the VPL. After that, it will follow the same course, PLIC, and depending where we are, it will go either to the feet or to the arms, wherever you feel the pain. So the important part is that bottom part right here is that it synapses at the level where it enters, where our touch and proprioception doesn't matter if it entered wherever it entered. It had to come synapse up here in the medulla. And then if we talk about the pain in the face, we'll just go back here to our trigeminal. So let's say we feel some type of pain or fire to the V3. It will still synapse in the dorsal root ganglion, but now it will not go to the chief sensory. It has its own nucleus. We can draw that right here. So that nucleus is pretty long guy, and he's the body of the chief, basically, the fire of the chief. And at this level, this is called the spinal trigeminal nucleus for pain and temperature. So the difference here is that just like the difference of our body is that synapse is at the same level, the odd thing here is that it will descend down and synapse at the second cell body in the spinal trigeminal nucleus, and then it will cross over just like everything else, travel all the way to the VPO, wherever you feel the pain. So that is everything. Hope I didn't make it. Hope I made it less complicated, and we will continue on.